Okay, let's unpack this. Imagine having a shortcut, you know, a way to grasp some really complex challenges in healthcare, specifically how big programs actually get implemented, and then, crucially, how they adapt in the real world. Today, we're doing a deep dive into a fascinating paper. It's from Implementation Science Communications, and it explores how these things called implementation logic models are used, and importantly, how they evolve. This is all within a major healthcare initiative. So our mission, pull out the vital insights for you quickly.
Exactly. And what's really interesting here, I think, is that these implementation logic models, or ILMs, they act as a kind of visual roadmap. They're tools, right, to conceptualize why certain strategies get picked, how you measure the impact. And they also communicate the key bits of a project really clearly. Think of it like a blueprint for turning evidence into actual practice.
A blueprint. Okay. But you mentioned evolving, so not a static blueprint. Let's ground this. The paper focuses on a really good program funded by the Veterans Health Administration, the VA. It's called the Quadruple Aim QUERI. QUERI stands for Quality Enhancement Research Initiative. Their goal is huge: enhance veteran outcomes, improve how clinicians feel about their work, and reduce healthcare costs, especially for what they call dual-use veterans. These are folks getting care from both the VA and community providers. So it's really about transforming care coordination, tackling it in high-risk groups using specific evidence-based programs, things like a care coordination and management project, the transitions nurse program, whole health coaching, stuff like that.
Right, and that's a complex environment. So initially, this quadruple aim query, it started with two main implementation strategies. One was called iterative re-amprism, basically using a framework to check the impact like reach, effectiveness, adoption, those dimensions. The other core strategy was relational facilitation. That one's more about improving communication, relationships within the teams, using things like surveys and setting goals together. Those were the starting blocks.
Okay, starting blocks, but here's the kicker, right? The really interesting part you hinted at. These strategies weren't just set in stone. The paper shows, and this is a key finding, that implementation strategies aren't always these distinct, separate things. Their delivery, how they're adapted,
Yeah.
it's dynamic, it's guided by the data coming in. So they evolved. New strategies got added beyond those first two.
Exactly. They had to adapt. For instance, some projects brought in new tools, like a data dashboard giving real-time feedback from electronic health records. That's pretty powerful. Or even something called a brain rating premortem exercise.
A brain writing premortem? What's that?
It's a way to get teams thinking about potential barriers before they even start implementing, sort of identifying pitfalls in advance.
Okay. Proactive problem solving built into the process.
Precisely. And if we connect this to the bigger picture, these evolving ILMs, these living blueprints, they were incredibly helpful, really useful for coordinating work across all these different projects, clarifying goals for the study teams and their partners, and crucially for understanding what actually worked best and why.
So that adaptability was key.
Absolutely. But it also raises an important point the paper notes. While these models are super useful, they have challenges, like how do you convey all that complexity, all that adaptation in a limited visual space? Or detail all the underlying reasons, the mechanisms behind why things changed? It's tough.
Right. You can't capture every single nuance. So wrapping this up, what's the main takeaway here? It sounds like implementation logic models are powerful tools, especially for these big, complex health initiatives. But their real strength isn't just the initial plan. It's their ability to change, to adapt, to reflect what's actually happening on the ground. They're not static plans. They're living documents that grow with the project.
That sums it up perfectly. And, this insight isn't just for huge VA programs. Think about it for yourself. Any complex project, maybe even personal goals. Consider mapping out your own approach, like a simple logic model. But then the key is being open to that iterative adaptation, changing things based on what you learn as you go. How might a logic model of your own evolve over time? Something to think about.